During an abdominal procedure, the surgeon requests a laparotomy sponge count before closure. One sponge is missing. What should you do first? A. Continue closure and look later. B. Notify the surgeon and search the sterile field. C. Assume it's on the floor and finish. D. Document the missing sponge without telling anyone. Answer: B. An immediate search of the sterile field is critical to prevent retained surgical items. Communication with the surgeon allows for a coordinated search before closure. Which position is most commonly used for a laparoscopic cholecystectomy? A. Supine with reverse Trendelenburg. B. Lithotomy. C. Prone. D. Lateral decubitus. Answer: A. Supine with reverse Trendelenburg improves exposure of the gallbladder by allowing abdominal contents to shift downward. This positioning also facilitates optimal trocar placement. While setting up instruments, you notice one has dried blood from a previous case. What should you do? A. Wipe it with sterile saline and use it. B. Replace it with a properly sterilized instrument. C. Continue using it since it will contact blood anyway. D. Boil it quickly in the back room. Answer: B. Using any contaminated instrument risks introducing pathogens to the surgical site. It must be replaced immediately with one that has undergone proper sterilization. Which of the following sutures is absorbable? A. Silk. B. Nylon. C. Polypropylene. D. Polyglycolic acid. Answer: D. Polyglycolic acid sutures break down in the body over time and are absorbed naturally. This makes them ideal for internal tissues that don't require long-term support. A patient undergoing a craniotomy is positioned with the head elevated. What is the main reason? A. Reduce risk of air embolism. B. Improve anesthesia gas delivery. C. Promote venous drainage and reduce intracranial pressure. D. Increase blood flow to the brain. Answer: C. Elevating the head promotes venous drainage from the brain, lowering intracranial pressure during surgery. This helps improve visualization and reduces complications. Which of the following is a critical step when handling sharps on the sterile field? A. Pass directly into the surgeon's palm. B. Use a neutral zone for transfer. C. Pass over the sterile drape. D. Leave them on the Mayo stand. Answer: B. Using a neutral zone reduces the risk of sharps injury by avoiding hand-to-hand passing. This is an important safety protocol in the OR. The term timeout in surgery refers to A. A break for staff. B. Cooling the patient's body temperature. C. Checking anesthesia depth. D. A pause to verify patient, procedure, and site. Answer: D. A timeout ensures all team members confirm the patient identity, surgical site, and planned procedure. This reduces wrong site, wrong patient, and wrong procedure errors. During an emergency trauma laparotomy, the surgeon requests a rapid suction setup. Which device should you prepare? A. Fraser tip. B. Pool suction. C. Yankauer tip. D. Robinson catheter. Answer: B. The pool suction is ideal for removing large volumes of fluid from the abdomen quickly. It has multiple holes to prevent tissue from clogging the suction. Which instrument is used to clamp blood vessels before ligation? A. Metzenbaum scissors. B. Adson forceps. C. Kelly forceps. D. Army-Navy retractor. Answer: C. Kelly forceps are designed to grasp and occlude blood vessels temporarily. This facilitates safe ligation and prevents unnecessary bleeding. While counting instruments after closure, you realize the count is off but the patient has left the OR. What should you do? A. Ignore it if it's a minor item. B. Notify the charge nurse and document the discrepancy. C. Tell the next shift to check. D. Dispose of the instrument quietly. Answer, B. Missing items must be reported immediately, even postoperatively. Documentation and investigation are essential for patient safety and legal compliance. Which of the following is a self-retaining retractor? A. Deaver. B. Richardson. C. Balfour. D. Sen. Answer, C. The Balfour retractor holds itself in place, freeing the assistant's hands. It is often used in abdominal surgeries for prolonged exposure. When preparing for a total knee arthroplasty, which implant component is usually inserted first? A. Patellar component. B. Tibial component. C. Femoral component. D. Spacer. Answer, B. The tibial component is placed first to provide a stable base for aligning the femoral and patellar components. What is the primary advantage of using a double gloving technique in surgery? A. Improved dexterity. B. Increased tactile sensation. C. Added barrier protection against sharps injury and contamination. D. Faster donning of gloves. Answer, C. Double gloving provides an extra layer of protection, reducing the risk of exposure to blood-borne pathogens. It is especially beneficial during long or high-risk cases. Which antiseptic agent must dry completely before surgical draping to avoid fire risk? A. Chlorhexidine. B. Alcohol-based prep. C. Povidone-iodine. D. Hydrogen peroxide. Answer, B. Alcohol is flammable, so allowing full drying time before draping is crucial. This prevents ignition from cautery or other heat sources. The surgeon requests an instrument for holding a delicate blood vessel without crushing it. Which is most appropriate? A. Crile clamp. B. Bulldog clamp. C. Alice clamp. D. Coker clamp. Answer, B. Bulldog clamps apply gentle pressure without causing vascular damage. They are ideal for temporarily occluding vessels during microsurgical work. In which case would a McBurney incision be used? A. Appendectomy. B. Caesarean section. C. Laparoscopic cholecystectomy. D. Abdominal hysterectomy. Answer, A. The McBurney incision provides optimal access to the appendix with minimal muscle disruption. It is often chosen for open appendectomies. Which type of sterilization is best for heat-sensitive items? A. Steam autoclave. B. Ethylene oxide gas. C. Flash sterilization. D. Dry heat oven. Answer, B. Ethylene oxide gas sterilizes effectively without high temperatures, making it safe for delicate instruments. It is commonly used for plastic and electronic devices. Which of the following is considered a countable item in the OR? A. Irrigation fluid. B. Skin prep solution. C. Vessel loops. D. Anesthesia tubing. Answer, C. Vessel loops must be counted before and after surgery to ensure none remain inside the patient. All countable items are tracked for safety. Which suture pattern is best for closing the skin with minimal scarring? A. Simple interrupted. B. Continuous locking. C. Vertical mattress. D. Subcuticular. Answer, D. Subcuticular suturing places stitches under the skin, reducing visible marks. This technique is favored for cosmetic closures. While draping, the sterile field is accidentally touched by a non-sterile object. What should you do? A. Cover it with another drape. B. Ignore it if small. C. Remove the contaminated drape and replace it. D. Continue using the area carefully. Answer, C. Once a sterile surface is contaminated, it must be replaced to maintain aseptic conditions. Covering or ignoring it risks infection. During a carotid endarterectomy, the surgeon asks for a shunt to maintain cerebral blood flow. What is the primary purpose of this device? A. Divert blood away from the brain. B. Block blood flow to reduce bleeding. C. Increase blood pressure. D. Temporarily bypass the surgical site to maintain perfusion. Answer, D. A carotid shunt diverts blood around the operative site, ensuring the brain continues to receive oxygenated blood during vessel repair. This minimizes stroke risk. Which surgical instrument is specifically designed for holding heavy tissue, such as fascia? A. Mosquito clamp. B. Coker clamp. C. Babcock clamp. D. Coker clamp. Answer, A. Coker clamps have teeth and a strong grip for securing tough tissue layers like fascia without slipping. They are not intended for delicate structures. While setting up for a thoracotomy, you prepare a chest retractor that can open ribs widely. Which instrument is this? A. Whiteliner. B. Finicetto. C. Gelpi. D. Balfour. Answer, B. The Finicetto retractor is a self-retaining rib spreader used in thoracic surgeries. It allows wide exposure of the chest cavity for lung or heart procedures. In ophthalmic surgery, why is povidone iodine 5% preferred over stronger solutions for prepping the eye? A. It is less irritating to mucous membranes. B. It is more powerful than 10%. C. It dries faster than other agents. D. It contains alcohol. Answer, A. A lower concentration of povidone iodine is gentler on delicate ocular tissues while still providing effective antisepsis for eye surgery. Which type of needle is used for suturing the liver to minimize tissue trauma? A. Cutting needle. B. Taper needle. C. Reverse cutting needle. D. Spatula needle. Answer, B. Taper needles penetrate soft, easily torn tissue without cutting. They are preferred for friable organs such as the liver to prevent tearing. While preparing instruments for sterilization, you find a power drill. Which special consideration applies? A. It can be autoclaved normally without precautions. B. It cannot be sterilized at all. C. It should be wiped only with alcohol. D. It must be disassembled and sterilized per manufacturer's instructions. Answer, D. Powered surgical instruments require specific cleaning and sterilization steps outlined by the manufacturer to ensure function and avoid damage. A patient undergoing laparoscopic surgery develops sudden bradycardia when the abdomen is insufflated. What is the likely cause? A. Pneumothorax. B. Vagal stimulation from peritoneal stretch. C. Blood loss. D. Carbon monoxide poisoning. Answer, B. Rapid insufflation can stretch the peritoneum, triggering the vagus nerve and causing bradycardia. Slow, controlled insufflation can prevent this. Which retractor would you prepare for use during a thyroidectomy? A. Army-Navy. B. Richardson. C. Green. D. Deaver. Answer, C. The Green retractor is specifically designed for thyroid and other neck surgeries. It allows gentle retraction without excessive tissue trauma. In a neurosurgical case, the surgeon asks for bone wax. What is its primary function? A. Lubricate bone surfaces. B. Seal bleeding bone edges. C. Promote bone healing. D. Disinfect bone tissue. Answer, B. Bone wax is applied to bleeding bone surfaces to mechanically block oozing. It does not aid healing and should be used sparingly to avoid interference with bone regeneration. During a total hip replacement, the scrub tech accidentally drops a femoral prosthesis on the floor. What is the correct action? A. Rinse it with sterile saline and use it. B. Blow it with sterile air. C. Wipe it with alcohol. D. send it for re-sterilization and open a new sterile prosthesis. Answer, D. Implants must be completely sterile before use. If contamination occurs, a replacement sterile implant must be obtained to ensure patient safety.